a lecturer in way back, I think before you were perhaps born, in the late 1980s. And I was, part of my job was to teach students couple and family therapy. And I really had a struggle with finding a model that gave the students more than theory, because you know how one is when you're just starting out with your professional training. You want people to show you what to do. The theory doesn't really get you out of that hard spot when you're sitting in front of a client, an individual client, or a couple, or a family therapist. So in that search, I came across Sue Johnson, who first developed emotionally focused therapy for couples. And I got trained early in the 1990s. And then as she began to see that the model's approach and interventions also work for clients specifically with depression, anxiety, and trauma. And again, trauma, not necessarily relational trauma, but because trauma often profoundly changes people's view of themselves and the world. So those are the three areas in which, when it comes to EFT for individuals, that I work in: depression, anxiety, and trauma. I hope that helps in answering your question.
Yeah, okay, thank you.
Thank you for that question, Samya. Elmien, how about we start the webinar now that you've kind of introduced yourself?
Right. People, so what I thought we would be doing is I first want to show you just a little bit of a clip of a client that I've been working with, so that I think it perhaps it's more interesting and engaging to weave in the little bit of the overview that we want to give you tonight. And obviously it's just a taste. It's a brief overview of how this model is informed by attachment theory and emotion theory, and the strategies or interventions that is used in the model, and what the training specifically focuses on teaching participants. Because the theory of the model isn't difficult to grasp, and it, most people say it resonates, it feels intuitive, but the doing of it is much more challenging. Specifically, one's capacity and micro interventions to help people access their own emotional experiences. And in attachment theory terms, the view of self and of other. And when we talk in attachment theory about view of self, it is about how lovable am I? How worthy am I of care or compassion? So often people who struggle with depression and anxiety and trauma have negative views of self. And often negative views of others, that other people will not be there for me. I can't depend on me. They only want the performing part of me, not the real me. There's all kinds of permutations of negative view of self or others that sit underneath depression, anxiety, and trauma, and that we need to access. And then related to that is how we've learned to regulate our emotions. So the proponents of this model, and it's also been, I think, well evidenced with research, is that depression, anxiety, and trauma-related distress are actually emotion regulation disorders. So hence the modality's name, emotionally focused therapy. But let me pause there for a moment and introduce you to the client that I want us to have a look at. do in terms of making sense of how come that she got to a place in her life where she has the experience of herself as incompetent, cannot do life, despite the fact that she has a master's degree in quite a scarce skills biotechnology area. Has done excellently in school, as I said, done 4 university degrees. So there's a lot of evidence that she's actually competent, but she has this deep felt sense in herself that she's going to fail. It's just one step away. So an email from a supervisor or a manager that does suggest she wants her to take more initiative. Immediately she goes to, they're going to fire me. And then I have to tell my parents, I have to tell my partner that I'm without a job. So when I, in EFT mode, assess such a client to make sense of her, my attachment theory framework says I need to explore her attachment relationships across her life and try and understand how that negative view of self has come about. Plus, her emotional regulation strategy is to flip from 0 to 100, become extremely distressed in such a way that she can't regulate herself. She doesn't sleep for days, and she can't calm herself down. And in her case, and we don't have much time to go into detail in that, is she has been born with an anxious temperament. Families on both sides, many people in her extended families or family have trouble with anxiety. So there's definitely a genetic component there. But also been exposed to a mother who was father left when she was still a baby, not even a year old. Her mother was very distressed by the abandonment. So one could imagine that even though the client can't remember it, that mum likely was at struggles of her own. And in attachment theory, one would imagine that a mum, because she was the only caregiver, there wasn't anyone else, a granny or an auntie, they were isolated in a strange country or a different country, that her mum was struggling to be present for her as this little baby and toddler had to navigate the world with an anxious temperament where one's anyway highly alert to danger and threat signals. And then having to go and visit a father who had very much difficulty with compassion. This was his only child, and he expected her to perform and to do well. And she had this experience of constantly disappointing him because she wasn't this lively, go-getter, dynamic entrepreneur girl that he wanted her to be. So that's the understanding, but as we know, it's all still quite easy to make a nice formulation in one's mind. The question is then, what do we do in emotionally focused individual therapy? And the first thing is to help people access their inner worlds, because we need to keep in mind that attachment theory says to us, if we're threatened, and that's what happened when we have stress in our life. So in for this client's case, she felt a threat that she would lose her job. And it was all related to her negative view of self. Then one's central nervous system hyperactivates.
Your last comment.
You feel under threat, there's fear, and then we employ our emotion regulation strategies. And if they are ineffective, they either try to suppress the emotion or they hyperactivate, like this client does. But in both instances, the emotion is not engaged and experienced. So it's either this push down, can't feel it, or this hyperactivation in anxiety, which is just almost a central nervous system condition. It isn't an engagement with what is my emotion. So I would, unless there's questions at this point, I want to show you just a few more minutes of how I engage with her emotion that lies underneath the anxiety. In other words, in what we do in EFT is with the therapist having a calm and restful pace, how we help people access all the layers underneath that anxiety is to almost co-regulate the client with your own voice. So it's a soft and gentle pace, and we try and get people as close as possible to their experience in the moment, even if it's online. Because the principle of emotionally focused therapy is you can't change dynamics that was fostered, almost burned down into a template into someone, unless you can help them experience that emotion again and help them have a corrective experience. In other words, a different encounter with the fear that comes up for them. So can I ask, in this moment, are there any questions that come up for you that would be worthwhile or important to engage with before I show you the clip that I have in mind? Right, but if anything comes up, just let me know. Go to the right spot again. Levels, and then see how we can get to other questions. Yeah, Sudipta, before I go to the training, because I see your work there, this modality isn't primarily for what we call personality disorders. It's more for the B cluster. In other words, borderline dependent, that has very much, and if you have read something of borderline dependent histrionic personalities, they are very much bound up with emotion regulation issues, and they're often also considered attachment disorders. So I wouldn't think that for those personality disorders that you're mentioning there, that it would probably be a good fit. So as I said, for now, it is more specifically for depression, anxiety, and trauma, and I've at times used it for the B cluster personality disorder. Right. So then the training. So firstly, all the emotionally focused therapy trainings are built on a training model that consists of people hear the theory. So there's little teaching bits. Then there's a demonstration, either by showing you video clips of me and other therapists demonstrating it with real clients. And then there's the practice component, where we will use fishbowl techniques where one of you and with a co-helper and I show you how it's done, and then you go into groups and buddy pairs, and I move around and you try your own hand at it, because we know it's when one tries your own hand at it where the practical questions come up and where you find where you need more help to implement the different interventions. Because as I said to you, the theory is easy to understand. It's just interventions and expanding your own capacity to help people linger with their emotional experiences and delayer it. And then for the second stage of the therapy, it's about how do we bring about corrective experiences. And the little piece that I wanted to get to is in EFT, we put people in conversation with parts of themselves or other people in their world who can't be in therapy with them, either a parent or a figure that has died or that would never join them for the therapy. And in the process of conversation, the therapist implements strategies to help people have a different conversation. So with the client that I worked with, we are still in the process of her being able to say to her dad, imaginary, because she could never have a discussion with him in real life. He won't ever be open to it. But what is helpful for her is to say in my presence, imagining him, to tell him how much he has hurt her. Nevertheless, I'm going off tangent here. I must get to my focus. About the training, I said to you, it's an experiential training. And in EFT, there's a first 4-day training that gives you the basics with some basic information theory, but more importantly, tools to go and do the model. And then there's a second level of training where we say it's called mastering skills in EFT. So the idea is once you've gone out and have your own practice with your clients and you have even more questions and you have more specific questions about how to implement the intervention, that's almost a master class kind of a training that's even more practice and working with case studies. And once you've done those 2 levels of almost formal training, you need individual or group supervision. So here we're talking then about not only the training requirements, but also the pathway to certification, if that is what you are aspiring to. First day, the EFT Essentials, what we now bringing to Delhi, and then the mastering skills in EFT is the next 4 days. And then you will, and it's so necessary for you to have supervision. And once you've done that, in collaboration with whoever is supervising you, you can then submit an application for certification in EFT. And that application entails that you also make video recordings of your work to show that you've mastered some of the core interventions in EFT. And then those are reviewed by your supervisor and by an emotionally focused therapy trainer. And if they think you have those basic skills, you then get certification as an EFT therapist and you get the certificate, you listed as such on the International Center for Excellence in Emotionally Focused Therapy. So anybody across the world who's interested in EFT can then look for, say, a therapist, EFT therapist in Delhi, and will find your name. But I also want to highlight for you, because in the emotionally focused therapy world, we know it's a journey, and adding to our skills is, if you attend this 4-day training, you get your certificate, and you will get a 1-year free membership with ICEFT, and you list it again on an E level. And the E level means, and I hope I've got that letter right, if it is a E, anyway, as someone who's done the first level. And as you move on towards the other levels, your level of training is reflected in that. Okay, so that's me about the training. Are there any further questions about either certification or the training that comes up that you want to ask about?
I have a doubt. It's not regarding the training, it's regarding the technique. So, how you showed the first clip where the client mentioned that the emotion was sadness. So now that, since it's we're focusing on the emotion, and the first thing that we found out that the emotion she mentioned was that I feel sad. Do we go back in time and we ask them if, as if the emotion is familiar or not? When was the last time they had this feeling? So do we shift our focus from the feeling or the incident that might have happened that had led to that feeling? What do we focus upon once we actually get to the point that yes, this is the feeling that the client is actually having right now?
No, we stay with what is in the room, what is present. So in this case, and I hope I'm following your question rightly, that as I began to talk with her, what lay beneath the anxiety was actually the sadness. And the sadness had to do with, I'm not good enough. I am
Yes.
going to lose my job. I am going to. And then you say, can we stay with that sadness? Can you tell me what comes up for you when that sadness comes over you? And she often say that the sadness makes her heavy. She feels like she's trying to walk in heavy syrup. And we go to the body component and say, so what is it like for your body to feel in that heavy syrupy thing? Can you let me know? Can you feel it now? That heaviness? Can we check in with that heaviness that you feel right now of struggling to move in syrup? What that heaviness is telling us about you and what's happening for you. And then that body component helps us to not only help people be in that emotional experience in the moment, but then further engage with. And when you feel that heaviness of the sadness and the thoughts of, I'm not good enough, I will fail, I will disappoint people, what do you want to do then when you have that heaviness? And she would say, I just want to get away from it. And so I ask her, what do you do to get away from it? She turns to alcohol, or she's been prescribed benzos. So she drinks both benzos and anxiety. So that's her escape. But she doesn't linger in the sadness. And our job is to say, the sadness is not bad. It's horrible to feel sad, but it brings you an important message. And the message is, it's unbearable to live with this conscious idea that you're not good enough and that you will fail. It's horrible. to every day of your life expect the worst to happen. So can we talk about that fear? And then perhaps one can move into, when was the first time you think, or one of the most critical times in your memory of where that fear, together with the sadness and conviction that you're not good enough. And one could use that to process and to bring about a corrective experience, because the idea is that because of the emotional regulation of escaping the fear and the anxiety by alcohol, and earlier in her life, she did it by, she would go and visit a friend and let's go dancing, let's go do something. So it was always escaping. Is if we can learn her to linger with it and to feel that it's not unbearable. And that if you listen to the fear, there could be, or the sadness, there could be other ways of attuning to the sadness or the fear and do something different with it. So long response to your short question. I hope it shed some light.
Yeah, it does. So from there on, you actually could get an understanding as if that thing has happened before as well. While
Yes.
taking help from the previous incident, we still work on the current one, right?
Yeah, so the sessions would veer. So sometimes one would say, new session, like she did with this one that I showed you, because it was actually, I had more or less on my agenda to go to a father and revisit key moments in her relationship with him when she was terrified of him, and where he said to her, "You're pathetic, you're useless." To go back to those memories. But in this incident, I asked her, "So you look unwell, what's happening?" And she brought up this email. And so I knew, well, I stay with where the emotion are the hottest and the most accessible. And that's why I'm saying sometimes you will have space once someone in their current life and stresses are more stabilized. There's the space to go to that past memories. But in the first stage of the therapy, we're focusing on current events and experiences where people experienced emotion dysregulation, and they couldn't help to get themselves into emotional balance just to live a tolerable life. So that's the most of the stage 1 work. Right, are there further questions in the chat that we need to attend to, Aditi?
Although I've answered most of the questions, just some things that I'll let you know. We have 2 trainings happening in June. One is for couples therapy training and one is for individual. This webinar, although is for individual therapy training, the dates for couples work is 15th to 18th of June, and the training for individual is 20th to 23rd of June. I have shared the document for individual training here. If anybody of you wants to know more about the couples work or individual work, feel free to reach out to me on WhatsApp so that I can actually answer if any other questions are left. That's just about the training. Is there anything else anybody wants to know? You can ask questions.
Can I ask?
Yeah.
Hi, I'm Shakuntala. After the level 1 training, when we continue to work with clients and if we have any clarifications or doubts or if we feel stuck, is there any way to get in connect with the group or Elmien to get the doubts cleared?
The idea is, and I think Aditi can tell you a bit more about that, is to create peer supervision groups And those groups can then invite in people who have more experience with EFT, or they could arrange for me or other trainer to be there. So for sure, the idea is to create a community that could help you in your process of work. Because that's so important for us in EFT, because it is all about attachment, is we need other people to help us learn this model, and to also have a space where we can articulate our own fears and stuckness.
Yes, Elmien, we actually usually have support groups and supervision groups, peer supervision, as well as some study groups with the trainers or supervisors that are there. So we are offering a lot of hand holding with the training because apparently it's a very different model. And I came across a couple of therapists who did that training but did not have hand holding, so it was difficult. So we here, ever since we've started the training, we have supervisions, and Ankita is here. She's already trained in EFCT. She knows we keep interacting with each other on messages, phone calls, or supervision groups, study groups. So we are doing it with other groups, and we're going to be doing it with the new batches that are coming across. So you'll have doubt sessions and everything. It'll be catered to.
Thank you.
Any other question anybody else has?
There's a question about, are there any supervisors currently in India? I'm not aware of any. Aditi, are you aware of any
There are
supervisors yet?
not residing in India, at least yet. Elmin, there's one more question. So there's this probably therapist in from Oman, and he was mentioning that's in supervision and the practitioner credentials require the videotaping. Apparently, the clients over there may not agree to it. So is there any other way of getting to the certification for practitioner other than just the recording part? Because as much as I understand, that is a mandate, but you would know better.
Yeah. It is a challenge also in South Africa that people aren't very keen to be recorded. But I think sometimes it's also our own reluctance to ask people to record, because it feels like such an invasion of privacy. And all across the world, people have said to us, and if you make it part of your work, and explain to people what it is about. So making it part of your work, and only if you want to use it for certification, you will need their permission to show it, and you would know, and you can also give them that assurance. It will only be seen by a certified EFT therapist and an EFT trainer, nobody else. So that helps people, that it's not going to be posted on TikTok or YouTube or any funny places. But more than that, if it's really an issue, it's something that you can discuss with your supervisor if there are other ways that you could access demonstration couples. Because you could, and especially if you offer your service either free or discounted because a couple is also helping you, you may get couples from other parts of the world that can work with you online. So there are the ways to get around that.
Thank you. All right, guys, is there any other question? Because we're almost nearing our time.
Right, Aditi, I think people are all done with their questions. Thank you guys from my end for being here and all your engaging questions. I'm looking forward to seeing you in Delhi.
Thank you, Elmien. This was really nice.
Hey guys, take care. Bye bye.
Bye.